Hello, my name is Zahir Osman Al-Tahir Babikir. I'm a Sudanese expatriate working in the United Kingdom. I'm a specialist registrar in infectious diseases and virology. I'm also the Secretary General for the Sudan HIV/AIDS Working Group, also known as SHOG, which is a network of healthcare professionals dedicated to brokering effective transfer of knowledge to Sudanese frontline healthcare workers. For more details on SHOG, please visit our website at www.shawg.org. I recently undertook a 2-week assignment with the United Nations Development Programme through their Transfer of Knowledge through Expatriate Nationals program, also known as TOKTEN. And that was in late February and early March of 2011. I volunteered as an advisor on the prevention of transmission of HIV from mother to child, and I was accompanied by Dr. Bushra Hereka, who is a UK-based unitary medicine consultant and who is also the president of SHOG. Both of us worked as TOKTEN volunteers during that time. Our host institution was the University of Kassala in eastern Sudan. As you all know, it is a well-established fact that effective delivery of activities relating to prevention of mother-to-child transmission, known as PMTCT, is a highly rewarding intervention, as it can reduce the risk of transmission from mother to child from 45% down to less than 5% in breastfeeding populations. Also, it's very well known that the current HIV epidemic in Sudan is fueled by heterosexual transmission, and according to UNAIDS, nearly 60% of new infections occurred in women of childbearing age. And according to WHO reports, there are gaps in the existing PMTCT services, and these are evidenced by less than 1% uptake of antenatal HIV testing in Sudan, and also less than 10% coverage of antiretrovirals for pregnant women infected with HIV. There are also gaps in the medical profession in terms of knowledge related to HIV, and these gaps are mainly attributed to deficiency in undergraduate and postgraduate training curricula. Unfortunately, this has led to reluctance of clinicians to engage with HIV care and treatment activities in Sudan. And this has been further compounded by the fact that there is a very high level of stigma against HIV-infected individuals, which is more prevalent among healthcare professionals, unfortunately. At present, the low burden of maternal HIV infection in Sudan gives us more opportunities than challenges, and we need to make the best out of them. In view of that, SHOG sought partnership with local partners in order to equip frontline healthcare workers with the knowledge needed to deliver effective PMTCT services. We teamed up with the University of Kassala in eastern Sudan, who have shown keen interest to collaborate with us. SHOG and the University of Kassala sought assistance from the UNDP TOKTEN program in Sudan with a view to organizing a series of training workshops targeting obstetricians, pediatricians, physicians, midwives and health visitors. These workshops were run in late February and early March of 2011 and were attended by over 200 frontline healthcare professionals. We also organized, in collaboration with the Medical Students Association at University of Kassala, a symposium dedicated to addressing ways to combating stigma among combating stigma among healthcare professionals. And this symposium was attended by key religious and community leaders. SHOG and the University of Kassala signed a memorandum of understanding detailing future collaboration, and the MOU has mainly revolved around developing effective ways of transferring HIV knowledge through training workshops, establishing long-term clinical mentorship schemes, carrying out operational research in order to inform local health policy making, and also introducing clinical audits for the first time in the clinical practice in Kassala State. And we also offered assistance with regards to the development of undergraduate and postgraduate training curricula on HIV. Both the University of Kassala and Shok have been canvassing political support for PMTCT from local and national stakeholders, and thankfully these efforts have culminated in the adoption of routine HIV antenatal testing on an opt-out basis at Kassala New Maternity Hospital for the first time ever. This hospital provides antenatal care for nearly 60% of the residents of Kassala State. Towards the end of our mission, we held a joint press conference in Kassala outlining fields of collaboration between the University of Kassala, Shok and UNDP TOKTEN program. And this press conference was attended by a representative of national and local media. Our next scheduled activity involves delivering a number of training of trainers courses on PMTCT in other Sudanese states. Basically, we would like to replicate our success in Kassala in other parts of Sudan. This activity will hopefully be a joint venture with the Sudan National AIDS Control Program, the Obstetrical and Gynecological Society of Sudan, UNDP TOKTEN program, and the University of Kassala. And the aim is to ensure sustainability of HIV knowledge transfer. We are still waiting for the confirmation of this activity. Finally, I would like to express my thanks to the TOKTEN program team in Khartoum for their dedication and support throughout our mission. I would also like to thank the Sudan National AIDS Control Program, the WHO office in Khartoum, the International Health Alliance, and of course our excellent host, the University of Kassala. Thank you for your attention.